So today we're going to talk about diarrhea. This is also known as flux or lax bowels. Diarrhea is a symptom. It's not a diagnosis. It is a symptom. When possible, the underlying disorder should be what is treated. Severe diarrhea requires fluid and electrolyte replacement. During bouts of diarrhea, rest of the bowels, avoiding high-fiber foods, as well as fats, milk products, caffeine products, and alcohol are typically quite helpful. While the body is recouping, possibly drinking defizzed carbonated beverages and eating soft, easily digested foods like soups, crackers, bananas, applesauce, rice, toast may be quite helpful. Now, diarrhea results mainly from excess fecal water, and this can be created by a lot of different etiologies. Acute diarrhea that lasts less than 4 days is usually caused by some kind of a self-limiting condition like food poisoning or an infection. Diarrhea is produced by 4 distinct mechanisms. First one, increased osmotic load. Number 2, increased secretions. Number 3, inflammation. And number 4, decreased absorption time. Diarrhea classifications include acute diarrhea and chronic diarrhea. Acute diarrhea. With an acute diarrhea, the onset is typically sudden and it's present for less than 2 weeks. Acute diarrhea etiologies include infectious agents, bacterial toxins, drugs, or medications. Now, community outbreaks such as those that are found in nursing homes, schools, and aboard cruise ships typically suggest a viral etiology or a common food source. If there's outbreaks of diarrhea, acute diarrhea within family members, this is suggesting an infectious origin. Also, if you've had someone that's recently traveled abroad, this can suggest what's identified as a traveler's diarrhea. There are 2 forms of acute diarrhea: inflammatory diarrhea and non-inflammatory diarrhea. With acute inflammatory diarrhea, this form of diarrhea is typically associated with fever, bloody diarrhea, also known as dysentery, and dehydration. So when it involves the colon tissue or the colonic tissue, typically we're going to see that the blood's coming from damage to bacterial invasion into the wall of the bowel or a toxin. Now, with large intestinal involvement as well, the diarrhea tends to be small in volume at each episode, at each defecation. The cramping or the pain that develops is typically located in the left lower quadrant. They'll often have urgency and tenesmus. And tenesmus is spasmodic contractions of the anal sphincter. It's often associated with pain, and they have a sense of incomplete evacuation. Most outbreaks of acute inflammatory diarrhea have been traced to contaminated ground beef that has been improperly prepared, and this is believed to be the most common cause of infectious bloody diarrhea in adults. Now, over 90% of this diarrhea is self-limiting, and it responds within 5 days to just simple rehydration therapy. The symptoms and signs of dehydration include excessive thirst, dry mouth, decreased urination, overall weakness, lethargy, and folks, it's important to remember dehydration can lead to vascular collapse, metabolic acidosis, and can produce death. Now, acute non-inflammatory diarrhea is associated with watery, non-bloody diarrhea, and they typically will complain about periumbilical cramping or pain, possible bloating, as well as nausea or vomiting. Now, this type of diarrhea often suggests a small bowel enteritis, and it's caused by either a toxin-producing bacterium, like E. coli or Staph aureus, or a virus, or even parasites, like Giardia, for example. And these organisms disrupt the normal absorption and secretory processes in the small intestines. Now, with this diarrhea, if there is prominent associated vomiting, that's going to be suggesting either a viral enteritis or a Staph aureus like food poisoning. Let's turn to chronic diarrhea. Now, the etiologies of chronic diarrhea can be grouped into 6 major causes or pathological categories. And the patient may have one or more of these etiologies going on simultaneously. So the 6 major etiologies are osmotic diarrhea, secretory diarrhea, inflammatory diarrhea, diarrhea due to decreased absorption time, malabsorption-related diarrhea, and chronic infections. So let's look at each one of these. With osmotic diarrhea, this occurs when unabsorbable, water-soluble solutes remain in the bowel and they retain water. Such solutes include things like polyethylene glycol, magnesium sulfate, magnesium hydroxide, and sodium phosphate. Please note, these substances are typically all used in laxatives. Now, osmotic diarrhea also occurs with sugar intolerance. So if you have somebody that has lactose intolerance that's caused by a lactase deficiency, we may see this develop. Osmotic diarrhea may also be caused by ingestion of large amounts of hexatols, substances like sorbitol, mannitol, xylitol, and these are used as sugar substitutes in candy, gum, basically diabetic foods. Thing to keep in mind with this is that hexatols are poorly absorbed, and the hallmark of an osmotic diarrhea is that it will resolve when an individual fasts for a short time. Now, secretory diarrhea occurs when the bowels secrete more electrolytes and water than they are absorbing. There's several etiologies that can produce this. They include bacterial toxins, viruses, unabsorbed dietary fats, side effects from many drugs, various endocrine tumors such as gastrinomas and thyroid carcinoma are 2 examples. Now, this form of diarrhea may wake the patient from a sound sleep at night and they need to be running for the bathroom. This form of diarrhea can also be associated with laxative abuse. Now, the next category is inflammatory diarrhea, and this is also known as exudative diarrhea. And this can occur with some infections as well as diseases that cause mucosal inflammation or ulcerations. So examples of those diseases include Crohn's disease, ulcerative colitis, tuberculosis, extrapulmonary form, as well as lymphomas and cancer. The result from inflammatory diarrhea is that there's an outpouring of plasma, serum proteins, blood, and mucus along with the watery fecal content. This may include hematochezia, the presence of bloody stool, as well as unintentional weight loss, abdominal pain, and fever. The 4th category is diarrhea due to decreased absorption time. This is also referred to as motility disorders or acceleration of intestinal transit. So this form of diarrhea occurs when chyme is not in contact long enough with the GI tract to allow for adequate absorption. So it causes too much water to be retained in the stools. This can also be associated with surgical procedures like small bowel or large bowel resections where part of the bowel is removed, gastric resection, as well as bypass, surgical bypass. Now, this form of diarrhea is also associated with magnesium-containing antacids and laxatives. So if a person takes those forms, they may have diarrhea with this. Diarrhea due to decreased absorption time is also linked with or associated with certain disease conditions like hyperthyroidism, diabetes, adrenal insufficiency, as well as irritable bowel syndrome, which, by the way, is the most common cause for this type of diarrhea. Also, this form of diarrhea can be associated with certain dietary habits. For example, increased amounts of coffee, teas, or colas may activate this on some patients. The next category is malabsorption-related diarrhea. This may be the result of either or both osmotic or secretory mechanisms. This form is often associated with malabsorption conditions like celiac sprue, fat malabsorption, and carbohydrate malabsorption. Now, please note, a significant diarrhea that's in the absence of weight loss is unlikely to be due to this form of malabsorption, because the hallmark of these malabsorption states are weight loss and nutritional deficiencies. If this form of diarrhea is suspected, then the patient should have a stool fecal fat lab test performed. The final category of chronic diarrhea categories is chronic infections. This form of diarrhea is closely associated with parasitic organisms. The most common organisms that produce this form of diarrhea are Giardia, E. histolytica, and nematodes. So going back and just a quick overview of summarizing stool characteristics and source. With small bowel involvement, we typically see the following stool characteristics: watery, large volume, increased frequency, can be bloody but never grossly bloody, and it's associated with organisms like Staph aureus. With large bowel involvement or the colon involvement, stool characteristics include mucus and blood present, small volume of fecal material, increased frequency. When it's bloody, it's typically grossly bloody. It's associated with organisms like E. coli, Shigella, Salmonella, Campylobacter. Please note, Campylobacter is one of the most common bacteria that can cause diarrhea-type symptoms. And finally, we have to keep in mind that there are dietary factors that may worsen a person's diarrhea. They include things like caffeine. Caffeine can be found in cola, teas, coffees, headache meds, chocolate. Okay? Fructose is another dietary factor that may worsen diarrhea on some people. With fructose, it's found in the fruits and in juices, like high fructose corn syrup. Hexatols, sorbitol, mannitol, those diabetic sweeteners or sugar-free sweeteners that are used in gums and candies. Lactose can produce this on some people, so milk products, yogurts, soft cheeses. And then magnesium that is present in antacids, for example. And for some people, sucrose or table sugar can produce diarrhea. And then there's a whole host of other sources that we might have to consider based on a patient's presentation.